Hi, my name is Charlotta Enerback. I'm a professor of dermatology at Linköping University in Sweden. Psoriasis is a common chronic autoimmune skin disorders associated with systemic inflammation and an increased risk of cardiovascular disease. Genome-wide association studies have identified more than 80 psoriasis susceptibility loci, but the environmental factors are also important, such as infections, stress, smoking, alcohol, and different medications. These factors may exacerbate psoriasis or even trigger the disease onset. Nutrition in early life have been shown to influence the risk of developing other autoinflammatory diseases. For instance, breastfeeding was shown to have a protective effect in diabetes type 1, possibly by its effect on the gut microbiome, which in turn influences the immune system. However, there's a shortage of previous studies on the importance of early nutrition and breastfeeding in early childhood regarding the development of psoriasis. Specifically, prospective birth cohort studies in which the influence of nutrition very early in life can be investigated are absent. To address this, we have used data from the All Babies in Southeast Sweden ABIS study, which is a large prospective birth cohort including more than 17,000 individuals followed for more than 20 years. The children were born between 1997 and 1999, and the parents answered questionnaires at birth and by the child's age of 1 and 3 years. The diagnosis of psoriasis was received from the Swedish National Patient Register, and statistical analysis were conducted using custom-written R transcripts, and conclusions were drawn using quantitative estimates of their respective odds ratio with a 95% confidence interval. What we found was that individual breastfed for less than 3 months and they received an infant formula before 4 months were associated with a higher risk of psoriasis. The odds ratio was more than 1.8. The risk of psoriasis increased following large milk consumption with an odds ratio of 2.5. At the 3-year follow-up, the increased consumption of fish, especially from the Baltic Sea, increased the risk of psoriasis. Overall, the nutrition at 1 year of age seemed to be more important than nutrition of 3 years of age, where we saw fewer risk factors. So in conclusion, exclusive breastfeeding during the first 4 months of life significantly reduces the risk of developing psoriasis many years later through early adulthood, while the early introduction in Sweden of formula based on cow milks increases the risk. So based on these results, breastfeeding should be encouraged and facilitated, and the early introduction of formula should be postponed until after 4 months of age. An awareness of possible toxic agents in foods such as fish from lakes and the Baltic Sea is of value. It is clear that factors early in life influence the immune system and increase the risk of inflammatory diseases such as psoriasis, and further studies on the underlying mechanisms are warranted.